Welcome to Identifying Equitable Solutions with What Works for Health. My name is Erica Burrows-Girardi, and I am a Senior Outreach Specialist at County Health Rankings and Roadmaps. I'm excited to spend the next 30 minutes or so with you and my colleagues as we explore what works for health. In a moment, as we move through the webinar, I'll be introducing you to those who will be helping to deepen your learning. And right now, I'd like to introduce you to Michael Stevenson, who will be chatting with you during the webinar. Hi, Michael.
Hey, Erica. Great to be here.
Thank you, Michael. And I also want to introduce you to Kirsten Frobaum, who will be answering your questions in the Q&A box. Hi, Kirsten.
Hi, Erica. Thanks so much for having me.
Oh, absolutely. So if you have any questions as we go through the webinar, be sure to put those in the Q&A box so Kirsten can respond to them in a timely fashion. We will not have an official Q&A session for this particular short webinar. County Health Rankings and Roadmaps is located at the University of Wisconsin Population Health Institute. This program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation, including the Robert Wood Johnson Foundation. We exist for two primary goals. One is to improve health outcomes, and the other is to advance equity. We encourage community change makers like yourself to start with data to identify who isn't thriving. Then we point to evidence to share what research is showing works. Then we share guidance to help you take steps to action, like actually creating change. And then lastly, we offer stories to give you real life inspirational examples of what community change looks like. So CHR&R is comprehensive in that our goal is to provide you with tools and resources that move you from data to action so that in the end, everyone in your community has the opportunity to thrive. To learn more about our program, check out our CHR&R 101 webinar, and you can find it on our webinar page on our website. But Michael is also chatting out a link to that CHR&R webinar for you to take a look at it later. Today, we're going to focus on how we guide change makers in identifying evidence-supported strategies to create equitable solutions. The tools and resources that I'm referring to is called What Works for Health. And we are fortunate to have one of our most senior evidence analysts to help us learn more about what works for health. So please join me in welcoming Jessie Souls. Hi, Jessie.
Hey, Erica. Thank you so much for having me here today. I'm so excited to talk about my program.
And I'm excited to have you. And Jessie knows how much I like to call you all not evidence analysts, but detectives, because you're always searching for the latest evidence on strategies to help people just take actionable steps toward health. So we appreciate that. And I want to start by asking you a question. I just want you to start with just a big, broad overview about what works for health.
Of course. What Works for Health is an easy-to-use online tool to help find policies, programs, and system changes that affect the factors we know make communities healthier places to live, learn, work, and play. Right now, we're looking at the What Works for Health homepage, which features the health factors from the CHR&R model arranged as topic areas, which are shown in blue in both places. You can click on each topic to explore different ways to take action to improve health and well-being within communities. What Works for Health includes over 400 policies and programs, which we refer to as strategies. What Works for Health is a living resource. Our team of evidence analysts are continually updating and adding strategies to our website.
And that's why I call you detectives, Jessie. So,
I love it.
But I find What Works for Health to be a unique resource because it has so many features. Can you just tell us a little bit more about them?
Of course. Each of our strategies includes an evidence rating, which conveys how likely a strategy is to work, along with a description, evidence summary, disparity rating, and implementation examples. I'll expand on all of these features in much more detail shortly.
Perfect. So I appreciate you, Jesse. And now I'd like to introduce you to Robert Kurczynski. Robert is a health program specialist at the Utah Department of Health Comprehensive Cancer Control Program. Now, Robert is one of our #1 fans, and I'm so excited that he accepted our invitation to join us on our webinar today. Welcome, Robert. And I want to thank you for just sharing your experience with What Works for Health.
Thank you, Erica. It's so great to be here.
So why don't you start by telling us a bit about how you've used What Works for Health for Utah State Cancer Plan?
Yeah, so first I'll provide a little background. So the Utah Comprehensive Cancer Control Program, as part of our funding from CDC, is tasked with developing and implementing a state cancer plan every 5 years, which is basically a strategic plan that guides our statewide efforts to reduce the burden of cancer here in Utah. Now, we recently finished a draft of the 2021-2025 state cancer plan in which we worked really hard to embed health equity throughout. And this led us to select 4 equity-oriented priorities, which you see here, to advance cancer prevention and control. And for this conversation, I want to focus on the Create Healthy Neighborhood Environments priority. So this priority, like all others, contains what we call strategies, not to be confused with the What Works for Health strategies, as well as action steps to help achieve the priority in an equitable manner. So to give you an example, here's a glimpse of our priority on healthy neighborhood environments. And we include several high-level strategies in the plan that will help us to achieve this priority. In this case, 2 of the 5 that we've chosen relate to affordable housing and active living components to the built environment. And then because these strategies are relatively higher level, we also include a menu of evidence-based action steps that detail example options for how exactly to work towards the strategies. In this case, one action step that we've included for creating healthy neighborhood environments is community land trusts. And this is where What Works for Health has made all of the difference. At first, I thought I was going to have to basically do a series of informal literature reviews myself to identify specific action steps and track down the evidence base that underpins each of them for all of the priorities. I mean, I did know of 1 or 2 compendiums that existed for health promotion interventions, but they either focused a bit too far downstream for what I was looking for, or they had recommendations that were somewhat outdated when it came to the data they offered, or they offered interventions that were too broad to clearly operationalize, or they simply didn't have many options to offer at all. But then I stumbled on What Works for Health, and honestly, it was a gold mine of relevant information that I personally think is suited for people at all levels of public health wonkiness. So I saw that it offered hundreds of strategies for how to affect equity-oriented change in population health outcomes. And then for each strategy, the tool included an overview of the available evidence, a rating of the strength of that evidence, and then how the strategy was expected to impact disparities, and then diving even further, examples of implementation success stories and resources, if I was interested in that. And I realized that with this tool, the research was already done for me. So I ended up combing through all of the What Works for Health strategies that had either the first or second highest evidence ratings. And then I borrowed, with proper attribution, of course, the ones that were best aligned with our overarching cancer-related goals and feasible for our communities in Utah. And What Works for Health strategies wound up being a majority of the specific action steps that we highlight in our 2021-2025 plan that community partners here in Utah can pursue to lower the cancer burden while reducing inequities.
Yeah, that is so cool how you have found what you found, actually, like you said, the really, really unique parts of what works for health that sets it apart. And I will tell you, Robert, you are one lucky fellow, because years ago when I started in public health, I did have to comb through all of the evidence, but we have done all the work for you. And that's what I love about this tool. Now, I remember you mentioning how helpful that evidence rating is, and I'm going to turn back to Jesse. Jesse, can you help us understand what those evidence ratings mean that Robert was referring to?
Of course. And I'm so glad to hear that Robert has had such an incredible experience using our tool that is just absolutely the best. So to expand a bit more on our evidence ratings, when we examine the literature supporting a strategy, we think about three main things. We're considering the type of studies available and how well they demonstrate causality, how well each study was conducted, and the number of relevant studies we found, while considering if we see results replicated across studies. This all contributes to our evidence ratings, which are a quick way for you to assess what the evidence says about a strategy. What Works for Health's rating scale has 6 evidence ratings, ranging from scientifically supported, which is the strongest evidence of effectiveness based on systematic reviews, meta-analyses, and randomized controlled trials, all the way down to evidence of ineffectiveness for programs that have been conclusively proven to not work or to cause harm.
Mhm.
One of our most common and perhaps most useful ratings is our second strongest, some evidence. As our second strongest rating, these strategies are based on studies with substantial positive outcomes. They aren't rated higher because they haven't been studied enough to have systematic reviews available, or they could be the sort of program that researchers really can't conduct a randomized controlled trial on.
Mhm.
I would highly recommend giving them a closer look.
Mhm.
I'd also like to draw your attention to our expert opinion rating. Expert opinion strategies are recommended by credible experts and based on promising theory and practice. Now, in addition to our evidence ratings, we also provide disparity ratings, which tell us how likely a strategy is to work well for different groups, essentially closing gaps and promoting equity. What Works for Health has 3 disparity ratings. Strategies that are likely to reduce differences in health outcomes, essentially closing gaps, are rated likely to decrease disparities, while strategies likely to exacerbate differences are rated likely to increase disparities. Strategies that generally benefit entire populations are rated no impact on disparities likely. Disparity rating is an important feature of What Works for Health, and we're currently working on improving our methods, so please stay tuned.
Yeah, that's actually one of my favorite aspects of What Works for Health is this disparity rating. And once that disparity rating, like you said, you're working on ways to improve it, trust me, we will let you all know when they have unveiled some new work with that disparity rating. Right now, Jesse, I'm going to ask you to show us how we would actually find a strategy in What Works for Health.
Of course. Let's walk through a search to identify strategies that align with the priority area that Robert had identified for the Utah State Cancer Plan as being one of the most important for today's talk, creating healthy neighborhood environments. To narrow things a bit further, we'll look for strategies to accomplish their goal of increasing affordable housing. So here we're looking again at the What Works for Health homepage, and you'll see that we have the option to find strategies by topic, shown in blue. We could select housing and transit and review the strategies in that health factor, but instead I'd like to go through a keyword search. So we'll put in affordable housing in the search bar. Now you can see that our search for affordable housing brought up 16 strategies. Strategies on this list include community land trusts and broadband initiatives for unserved and underserved areas.
So thank you, Jesse. You just showed us very quickly two real quick ways to be able to get at some strategies. And Robert, now I want to bring you back into the conversation because, you know, you were looking at community land trust. That's one of the strategies in your draft plan. Oh, by the way, I should mention, Michael has chatted out a link to that draft plan that Robert provided for us. Thank you, Robert, for doing that, if you'd like to be able to take a look at it. But you used this particular strategy, and I was wondering if you could kind of walk us through how you decided on that strategy, and was that something that you were familiar with before What Works for Health?
So community land trusts was a term that I knew before I found What Works for Health, but I had a very minimal understanding of what it meant or how it actually worked in practice. Now, I knew I needed ideas for interventions around healthy neighborhood environments and the related components, such as affordable housing, physical activity infrastructure, et cetera. And so I used that search feature like Jesse mentioned. And when I came across community land trusts in the What Works for Health tool, I saw that it had a some evidence rating. So it had solid evidence to underpin it. And I also saw on that strategy page that there are hundreds of community land trusts that operate across diverse regions of the US. So that clearly reflected a level of feasibility. And then diving deeper, What Works for Health provided a nice overview of how the strategy works and the benefits as well. Housing stability and affordability are obvious ones, but also perhaps an increased number of spaces for physical activity or community gardens or other community gathering places to strengthen and sustain social cohesion, all of which are important for cancer prevention and control. And so I loved the multifaceted benefits of this strategy for our state cancer plan for Utah. Also, this strategy is at such a perfect level of granularity. It's not something vague like pursue policies and programs that improve the affordability of housing, which that's fine, but like, what does that even mean in practice? What exactly am I supposed to do with that, right? No, this strategy is specific, like, oh, okay, I can work towards improving housing affordability through community land trusts. I've got something concrete that I can focus on. But it's also not prescriptive. Like maybe I think this is a great strategy, but it won't work for my specific community. And so the bottom of the What Works for Health page for this strategy actually lists similar strategies that maybe I'd want to consider instead. And to be honest, Erica, there were so many gems like this one that I found on What Works for Health that are evidence-based. They reside in that happy medium of specificity, and they also have real-world examples to guide.
Yeah, and trust me, y'all, we did not pay him to say this. This is actually his experience. And that's what makes What Works for Health such a great tool. Now, Jesse is going to actually show us how to go through all of those aspects of a strategy.
Of course. And since Robert so kindly pointed to community land trusts, that is the strategy we're going to look at, which is one that I was lead analyst on. So looking at the strategy page, below the strategy's title, you'll see a description, which is the first paragraph that explains the nuts and bolts of the strategy, essentially what it is. On the upper left side, you'll see the evidence rating, showing that this strategy is rated some evidence. You can also read a short description of that rating here. Returning to the strategy text, you'll find the expected beneficial outcomes, which are the main outcomes suggested by the literature and have the strongest support. We also include other potential beneficial outcomes, which have weaker evidence supporting them, but are still worth considering. Below that, the evidence of effectiveness summary includes what we've discovered in our literature search, including additional detail about expected beneficial outcomes, the populations which may be most likely to benefit from the strategy, best practices and barriers to implementation, and as we have it, information about costs. Further down the strategy page, you'll encounter the strategy's impact on disparities. And throughout the page, you'll also notice the blue superscript citations. These are live links to the sources, and we try to include as many open access sources as possible across the full site. Now moving further down the strategy page, the implementation example section is where we feature up-to-date information about organizations that have used the policy or program and the variety of ways and locations in which it's been used, such as urban or rural regions. We also describe if it's been implemented at different levels of government. Finally, we showcase organizations that have adapted their program or services to changing circumstances more quickly than peer-reviewed articles are able to report on, and share useful resources such as toolkits and how-to guides. We also include an expandable section with the footnoted citations. And then at the absolute bottom of the page, you'll find our related What Works for Health strategy boxes. These strategies are carefully selected by analysts and feature programs and policies that are similar to the current strategy. Once you've come to the end of a strategy, if it doesn't feel like it's the best fit for your community, this can be a great way to find something which may end up being a better fit. All right, and now looking back to the top of the strategy page, I'd like to point out our new Save This Strategy and Print This Strategy buttons, which are located just below the strategy's title. All the strategies you save will now be collected in a strategy shopping cart at the top right of your screen, which you can download or share with others via email. This makes it super easy to keep track of all the strategies that you're interested in.
Wow, thank you so much for that tour of how we would explore strategy. And for all of you that are participating with us today, I hope you've learned something new. I bet you did not realize that What Works for Health had all of those features. And because I really love that list of resources that you guys, I just want to mention that again. There is a list of resources. So any of you who have to document or where you got your strategies from or why, making the case for why it was included in your plan, the resources right there already, all you got to do is copy and paste. So good. So now there's one new product that has been really, really used a lot this year, and that is the curated list. Let's talk about those.
Of course, I'd love to talk about curated lists. These are one of my favorite new projects, and it's something that grew out of us trying to create new things during the pandemic and really make sure that we were focusing on specific topics that move across health factors. So curated lists are collections of strategies that support community change efforts around specific topics and themes that stretch across health factors. They can help address complex health problems, systemic social issues, and local community needs and priorities. Looking at the middle list, you can imagine, for example, the wide range of strategies that can address and are related to climate change and health. This is an area that we're continuing to explore, so please stay tuned for more curated content.
Yeah, and that COVID-19 recovery curated list has been so helpful as people have been looking for strategies that's going to help them implement a recovery plan. And it's just right there. Basically, those are all the strategies we have related to COVID-19 recovery. And all you got to do is click on the list. How nice and easy is that? Come on. I love it.
We do our best to make it as easy as possible for users to find what they're looking for. So I'd like to thank everyone so much for joining us today to learn about What Works for Health and extend a huge thank you to Robert for sharing his experience as an actual real life user of What Works for Health. Hearing that he has used our tool exactly as it is intended is truly music to my ears. If you have questions about how to use What Works for Health, please contact us. Our team of evidence analysts is always happy to connect with users and try and guide you to the best of our ability. I hope that everyone has learned something new today about how What Works for Health can help you to identify strategies that are aligned with your community's priorities.
Yeah, thank you so much, Jessie, and my thanks as well to Robert. Hey, if you are have really enjoyed this webinar, or even if you didn't think it was that great, we don't care. We just want to know what you think about it. We would love to hear from you. Michael's actually chatting out a link to a brief survey, and I'm going to ask that you click on that link and then fill out this survey later, because we really do take your feedback to heart, and we would love to hear what you think about what you learned today. So thank you so much. And finally, if you'd like to connect with our program more broadly, please follow us on social media. We have a presence on Facebook and Twitter. But for the most up-to-date information about our webinars or what's happening with What Works for Health, I highly encourage you to sign up for our newsletter, because that's how you find out about everything new CHR&R. So again, I want to thank my colleagues for helping to deepen your learning today. Again, thanks to Robert Krasinski from the Utah State Department of Health, and to all of you out there who are making a difference, creating an equitable world. Thank you so much, and have a good afternoon.